Imagine the relief of a single drink after a night of racing thoughts, how the edges seem to soften, how the chest unclenches, and the mind finally allows a slow breath. That moment can feel like rescue. But beneath that brief calm is a complex chemical conversation between alcohol and the anxious brain, one that often turns a temporary shelter into a deeper trap. Today, we untangle how self-medicating with alcohol interacts with clinical anxiety, why the calm is so fragile, and how dual diagnosis care addresses both the mind's fear and the body's dependence. Anxiety is not just a feeling, it is a high alert state in the nervous system. The brain's circuits involved amygdala, prefrontal cortex, hippocampus are keyed to detect threat and prepare the body to respond. Neurochemicals like norepinephrine and cortisol rise, heart rate increases, sleep becomes scattered, and thinking narrows. For someone who lives with clinical anxiety, this state is frequent, intense, and exhausting. It is also a powerful motivator to seek quick relief. Alcohol arrives as an immediate and effective reducer of that alarm signal. As a nervous system depressant, it enhances the activity of GABA, the brain's primary calming neurotransmitter, and dampens glutamate, which fuels excitatory signaling. The result is a reduction in the intensity of anxious thoughts and bodily symptoms. The initial effect is real, and for many, it is persuasive. A pattern can form. Anxiety rises, a drink eases it, relief reinforces the behavior, and the cycle repeats. But alcohol's chemistry is transient. As it wears off, the nervous system does not simply return to baseline, it overcompensates. The brain, accustomed to the calming presence of alcohol, increases excitatory signaling and stress hormone production to rebalance itself. That rebound can present as heightened anxiety, panic, tremors, or insomnia, sometimes worse than the original symptoms. This is a key reason why people who self-medicate with alcohol report escalating anxiety over time, despite more frequent drinking. Layer on the adaptations of chronic alcohol use, and the picture becomes more complicated. Repeated exposure alters receptor sensitivity and stress response systems, making the body more reliant on alcohol to achieve equilibrium. Tolerance grows, requiring more alcohol for the same effect, and withdrawal symptoms emerge when use is reduced. For someone with clinical anxiety, these physiological shifts can mimic or amplify the mental health condition, creating a dual problem: an anxiety disorder and a substance use disorder that feed each other. Effective treatment recognizes this interplay rather than treating either issue in isolation. Dual diagnosis care, sometimes called integrated treatment, addresses both the underlying anxiety disorder and the physical reliance on alcohol simultaneously. This approach begins with a thorough assessment by a multidisciplinary team: psychiatrists, therapists, addiction specialists, and medical clinicians, who map the patterns of symptoms, substance use history, medical risks, and psychosocial factors. The first practical steps often involve medically supervised detox when necessary to safely manage withdrawal while minimizing risk. Parallel to detox, psychotherapeutic interventions begin. Cognitive behavioral therapy targets the anxious thought patterns and avoidance behaviors that prompt self-medication. Exposure therapies, when appropriate, help patients build tolerance to feared situations without turning to alcohol. Meanwhile, medications such as selective serotonin, reuptake inhibitors, or other anxiolytics may be prescribed carefully, balancing benefits with the risks of interactions and dependency. Crucially, relapse prevention and skills training are woven into the plan. Patients learn distress tolerance techniques, grounding exercises, and healthier coping strategies. Family involvement, peer support groups, and ongoing medical follow-up strengthen resilience. The aim is not only to stop harmful use, but to restore the nervous system's ability to regulate itself and to reduce the need for external dampeners. The story of self-medicating is often one of short-lived relief, followed by unintended consequences. But it is also a story of recoverable systems, brains, and bodies capable of recalibration with the right care. Dual diagnosis treatment offers a structured path out of the cycle, treating fear directly, breaking physical dependence safely, and rebuilding reliable tools for calm. If anxiety has driven you or someone you love to reach for alcohol, know that understanding the biology behind that choice is the first step toward a different, sustainable kind of relief.